got a lot going on. They're in their outfits. So this is the high altitude experience that we're doing here. So we're going to do some tests on the exercise bike at sea level and then simulated altitude. So right now these are the Hypoxico devices, and they are running at about 9,000 feet. So people who go from one bike to the other are going to put that mask on and be up 9,000 feet. And we're going to see what happens to their heart rates and their oxygen saturations when they switch bikes. Brandon, who some of you know if you're athletes, is going to help with sea level bikes. You're going to get a heart rate monitor on, and you're going to have one O2 sat meter you're going to share between the two. You wouldn't expect saturation to decline too much. Over here, you're going to put the mask on, and you'll have your own heart rate monitor and saturation attached to your finger. Two people will be recording data. So at the sea level, we're going to have one person record heart rate and one person record saturation. And what you want to get is the highest heart rate per stage and the lowest saturation per stage that you see, and you write that down. Okay? So the stages for the bike are pretty easy. So we'll have a 2-minute rest, because that's especially important here with the hypoxic gas. And then 30 seconds at 100 watts, 2 minutes at 150, 2 minutes at 200, and then you have 30 seconds if you're one of the riders to decide what you want to do.
We want to be at 100 watts for 30 seconds.
Good sea level, should be good.
Cool.
They're struggling now. That's better. Are you guys ready?
Is it all right?
I think so.
So remember, highest heart rate, lowest sat.
5, 4, 3, 2, 1.
Great. Yeah. So they're on, how much time they have?
About 40 seconds left. In the 200
Okay,
watts.
40 seconds in the 200, then you can do whatever you want. You can go up, you can go down, you can take it easy, you can rip that mask off and say enough is enough. Remember, if you start to feel dizzy, let us know. Come on in a little closer. These guys are working for you, letting you off the hook. Hey.
Well, ladies and gentlemen, welcome to the base of Mount Kilimanjaro, and welcome onto the stage, the Stanford University Exercise Physiology Improvisers. Lots of decisions need to be made.
Let's talk about it.
All right, so right now it's 3 months before going to Kilimanjaro. You're gonna have 2 minutes to listen to us, 4 minutes to make a decision in your group, and then we're moving on. At each phase, you have to make a decision, and at the end of our trip together, we'll see how you fared in Kilimanjaro.
So you start 3 months back. We'll each tell you about one training thing that we think is really valuable. Then there will be 2 weeks away, 5 days away, and then there will be 48 hours before the race. Now, we know that at altitude,
He's never even been to a mountain.
is that we have a lower workload at our highest VO2 max, right? What I'm gonna do with you guys, I'm gonna train you for the next 5 months. We're gonna push your VO2 max so high that even when you hit that lower workload, it's gonna be high enough that you're still trudging, and you're still moving up the mountain when these guys are laying out, breathing and huffing and puffing.
There's nothing better than the real deal. Just go to altitude, take a trip. Your body has this memory, this body memory for what it's like to respond to altitude. It totally does. Just like your immune system does. If you go to altitude, let me tell you what's gonna happen. You go now, your body's gonna learn how to respond more quickly, so you're more prepared for Kili 3 months from now.
No, the answer is EPO. You guys all know about Lance Armstrong. How did he win the tours, right? He won every high altitude stage. Why? EPO. Increase your red blood cell count, increase your oxygen carrying capacity. That's where it's at. It's all about the drugs. I'm telling you.
Let me tell you what's gonna happen if you take drugs. First of all, you just don't do that. That's wrong. Secondly, when you go to altitude, your plasma volume is gonna go down, which we know is gonna happen. And with an increased hematocrit, that higher red blood cell count, means that you're gonna put yourself at risk for having a heart attack. I don't know if you wanna put yourself in that position, but I'm certainly not going
Did
to.
Lance have a heart attack?
All right, you guys got 4 minutes, go!
I'm telling you, EPO is where it's at. You gotta take the drugs. Lance did it. Lance won. At altitude, it's gonna work. More red blood cells, carrying more oxygen. That's what's up. I'm telling you guys. Why wouldn't we just travel the parkway up, right? Acclimatize yourself halfway, get that process started, right? Increase your ventilation, plasma flow is going to go down, hematocrit concentration goes up, right? We're allowed to saturate that oxygen. Why wouldn't we do that, right? We gotta get that started. We gotta get that process started. I'm telling you.
I agree with you 100%, right? Bringing your hematocrit up is the right thing to do.
But why are you going to travel up a mountain when we can increase your hematocrit right here? I got altitude tents for you. You come in, you sleep in them. We're going to get your altitude. I mean, your hemoglobin content way up. You're going to be able to carry that oxygen.
All right, so let me tell you what you need to do. 5 days beforehand, if you go halfway up the mountain, then you're gonna have a really bad sleep. You're gonna start detraining 5 days before your peak performance time. We don't wanna do that. So what should we do? Keep it simple, hydrate, hydrate, hydrate. Put water in your body, and if you do that, you're gonna be able to offset some of those negative adaptations or responses that you get at altitude, like reduced plasma volume. And so that reduction in plasma volume will be offset by being really well hydrated,
we want that
protecting
reduction in
you
plasma
against
volume.
acute mountain sickness, which I know you guys don't want.
Increases your transit time if it's thicker. If your blood's more viscous, you get that transit time. You don't want to decrease in plasma volume is a good thing. And if you're drinking all this water 5 days before, you're just going to pee it all out before you go up the mountain anyways.
All right, decide for yourselves. You got 4 minutes.
Benefits in terms of preventing AMS. You need that pressure differential. So why wouldn't you just go partway up the mountain, right? So it does the same thing in terms of a low O2 environment, but it also gives you that decrease in pressure.
But where are you leaning? You see,
Go up the mountain. Get the pressure and the altitude.
right. So I can see why I'd make that mistake. Right. But if this is right before you're about to go up to altitude,
Partway up's the way to go.
I'll tell you what's going to
Nothing better
happen.
than
5 days
real
beforehand, your first night's at altitude, you sleep really poorly. So you're basically, sleep is what your body really needs before you perform anyway. 5 nights of bad sleep is going to equal 1 bad performance of it.
Whereas like you guys
You're definitely thinking 10.
during the day when you're working out,
Pressure in the tent, you don't have any pressure differential. Or like there's no low pressure.
Yeah, but you have low oxygen. And the stimulus that you're getting up on that mountain is the same low oxygen.
5 days before is over. We're 2 days into our experience at altitude in Kilimanjaro. We're making our way up the mountain, and you guys have one last choice to make. I'm sensing from some of you I'm interacting with that maybe I'm coming off a little gimmicky. You may not trust what I'm having to say, but this is, there's one choice to make here, and that's take Diamox. It's standard practice. Anybody who's ever gone to altitude takes Diamox or something like it. It's a carbonic anhydrase inhibitor. Do you guys remember a little bit about the buffering system? It affects enzymes, so you increase the acid levels in your blood. Remember, increased acid means you're going to ventilate more. And ventilation is limiting when you first get to altitude. So if you can turn on a body system so that you can breathe more, you're going to put yourself in good position for success.
I've heard some just interesting stuff about that drug, and I don't totally remember
Probably
it,
not
but
true.
there was a lot of stuff about 40% of people who take Diamox are,
That was one
limited in
study,
their
and it was actually
performance.
25%.
25% of people are limited in performance when they take Diamox. So you want a quarter of them. So 3 of them could get to the top. We'll just leave 1 person, right?
Leave your friend behind.
Now, I have a totally different idea. What I think you guys should do is this thing called desensitization. And what you do is as soon as you get out there, we're going to exercise really hard. We're going to climb very fast initially, right? And we're going to get this huge acclimatization process that's going to allow us to finish the rest of our trip quickly before you have all these problems that come with Diamox.
No. Within 6 days, that's going to hit you day 2, my friend. Now, what you have to do is you have to take it easy once you start up, right? So you have to allow your body to acclimatize, go through this process, start slow, and then once you're through that AMS stage, we can go higher, we can go faster, right? So you it's like a neural component, right? You have to give time for your brain to adjust to that new low O2 environment. That's the best way to go. You just start up slow. Once you're used to it a little bit, then we can kick in and go high, go fast. That's the way to do it.
We're still going to beat you
Take it easy. Not if you guys passing out quarter way up the mountain.
All right, decide for yourselves.
You want that transit time, but I think that was for the 3 months before.
Yeah.
Don't let us distract you. You guys made your choice already? Yeah. You have.
What do you guys think?
Yeah, what do you choose?
We're gonna take it easy.
We're going to take it easy.
Top of a mountain.
So we are interested in what you think about these. So you were given some correct information, some false information. Some of you've watched the video, some of you haven't. So we want to see sort of how it came out. So what do you think? First 3 months, you're trying to go climb Kilimanjaro. You want to do the best you can. You have these different options. Which of these do you think is the best thing for you to do? What did you write down in your sheets? We have an A. We have a B. Anyone say C? So we have B, A, B, B, C, C. All right, good. So pretty evenly mixed. Good job, you guys. Way to sell your thing. All right. So who wanted A? Who thinks A is the right one? Okay, and why do you think that's good? They're fighting. They're duking it out back there. So why is that good? Super endurance training. So you're already in pretty good shape. So this is actually going to that next level, right? You're already in good enough shape to climb the mountain, but you go out there and you just hammer yourself and you get better and better. Why would that be helpful? Come on, you all raised your hand. You had a reason. Why would that be helpful?
Increased vascularization.
Increased vascularization. Okay. That's a little bit fast. For 3 months, you'd probably need a little bit more time, but you'd get some, so that's good. That's a plus. Anyone know of a con that they wouldn't? It's like, being in good shape is great. Get to the top of the mountain, got to do this challenging thing. Being in good shape is good. What's a con to that? Why might that not be so effective?
Increased transit time.
Aha. So increased transit time. Actually, it's decreased transit time, but get the idea. So something to do with transit time. So increasing that cardiac output going to mean that the blood's flowing faster through the heart, which means there's going to be less time to saturate that blood. And so you might not get the benefit that you would if you did this at sea level. So it won't be necessarily a negative, but it won't necessarily be as big of a positive as one might think. So I might just skip over that one a little bit. What about travel to altitude? So what's the good thing about that? Acclimatization, right? So we know acclimatization is good. What's one of the drawbacks they were saying? It turns out that this is actually, if I had to do one of these, it would be that one. All right? It's not that this is bad, it's just that it doesn't give you that much bang for your buck. If you do this, it actually does carry over. You have some certain amount of memory from acclimatization, so you acclimatize more rapidly the next time. It gets you up there. It allows you to sort of see what it's like to be at altitude, where you're going to have your problems, etc. A couple of you picked this. So doesn't it seem like this would be a good idea? Right? Increase EPO, increase red blood cells. You're trying to get more red blood cells at altitude. Seems like it'd be a really good thing. Turns out they've actually done studies on this because it seems like it should be an obvious choice, and it doesn't really help. So when you go up to altitude, what's limiting when you first get there is ventilation. So you have more red blood cells than you can actually saturate at that time. And so you have to let your ventilation catch up. And the best thing you can do is hemoconcentrate, not get more total blood, which is one of the things that does because of the transit time issue. So this is, it seems like it should be a good one. It actually doesn't work as well as you'd expect. All right, 5 days. So you get 5 days. You go partway up the mountain, altitude tent, or hydrate. How many people picked partway up the mountain? Ah, a lot of people. You don't get to vote, Emily. Altitude tent? Good. Hydrate? Oh, ouch. Corey. All right, well, this one may have been a little bit more straightforward. So this is actually the one, right? So you go 5 days up. This has been shown over and over again, this pre-acclimatization. You go up, you jumpstart that process. You're not detraining yet, which is supposed to be one of the negatives that they were throwing out there. This altitude tent, you'd think was kind of the same thing, but it's not a strong enough stimulus. So because it is normobaric hypoxia, so normal pressure just changes the percentage of gas, like those things right there, not hypobaric hypoxia, so not lower pressure. It is a slightly different beast. It doesn't carry over in the same way. It doesn't pre-acclimatize people. So a lot of people use these tents when they're going to the mountains to prevent acute mountain sickness. It doesn't have the same carryover effect. right? So it does, in some people work for performance at sea level and some people performance at altitude, but it's not a sure thing and it's not a very strong effect. Any questions on those? Any argument that you heard that you want to throw out there? All right. 48 hours. The first 48 hours are critical to how well you're going to do on that mountain. How many chose Diamox? Interesting. How many chose desensitization? Interesting. Take it easy. Okay. I guess that wasn't a very good comparison. All right, so Diamox, why didn't you choose this one? Why did you think this was not the right choice? Come on, there must have been a reason.
They said like there's 40% reduction in performance.
I would take it. Okay, so I would take it. I would actually do both of these. So the Diamox, if you're going high enough to Kilimanjaro, will reduce symptoms of acute mountain sickness. And it does reduce performance by maybe 20 or 25%, but so does throwing up for 2 days, right? So if you can get over that acute mountain sickness hump and then stop taking the Diamox or even take it all the way through, then it might be worth it if you're not really, really sick. It is a diuretic, and actually that's one of the ways that it works. So, because when you're first up in the first 48 hours, you lose plasma volume, and you try and hemoconcentrate the blood. One of the reasons why this doesn't work, because it's not the same, it gets to the same endpoint sort of, but a different mechanism. So this can actually be beneficial. Diuresis jumpstarts that loss of plasma volume, reduces the sickness, and will impact performance to a certain degree. This obviously not a good thing. The worst thing you could do would be to do what we just did to these guys when they first got up there, right? So we take people to the peak, we do a V2 max test, their saturations fall really low, that just accelerates the process of getting to acute mountain sickness when you get those sats down in the 60s, right? So this, not so good. And then this is also a really important thing. So taking it easy, letting your body have time to acclimatize, not climbing too rapidly, so not going through, not going too much elevation gain at a single time. And then once you start to get your altitude legs, then start pushing through the climb a little bit faster. All right? Good job. So in general, you're making good choices. And some of you were doing that without even seeing the background information. Now you get to go and you get to watch those videos and see why these are the good choices, all right? Have a great weekend. Yeah. See you on Tuesday.